officials in their investigation of the cases, particularly at the affected nursing home. I signed an emergency declaration proclamation on Saturday, and this will help the states provide additional resources to respond to the outbreak. That directs state resources to be utilized wherever reasonably possible to assist affected communities, and also to respond and recover from the COVID-19 cases. It also implements our state comprehensive emergency management plan to maximize statewide coordination of all local officials. And I just do want to note, we have been very pleased of the coordination of multiple government agencies in that regard to date. Over the weekend, officials at the Office of Financial Management spoke with the chairs of the legislative fiscal committees under my direction, and we are planning to ask for $100 million to be dedicated to this response in this year's budget. It will be used for both state and local public responses in regard to these efforts. I don't believe that funding to address the outbreak should be a problem in this regard. The matter is too urgent. We are also evaluating surge capacity in our healthcare system. We are evaluating multiple sites right now in search of the best locations to effectively serve both isolation purposes, as increasing numbers, which we anticipate would need isolation, and also medical services to help those folks in the event that they have symptoms. We've also asked the federal government to release from its stockpile a variety of medical equipment. That came up in discussions today with the Vice President, and I'm reasonably confident that those requests will be honored. People need to begin to think of this in some other realms as well. We think folks should begin to think about avoiding large events and assemblies. And we are not making a request formally right now for events to be canceled, but people should be prepared for that possibility and need to be thinking about it. As this situation develops, what people are likely to see is that local officials, county health, and school districts responding to this. I also have emergency authority in this regard. We are not exercising it today, but people know that we need to start thinking in these terms. I want to reiterate too that other agencies have independent authority and decision making about these activities as well. I know this is a difficult situation, but I want everyone to know that Washington State is involved in a very comprehensive partnership right now. I'm asking all Washingtonians to take care of themselves and their loved ones, and I will look forward to working with everybody to a successful completion of this to get us back in a safe position. With that, I want to turn this over to Secretary John Weisman of our Department of Health.